Hello, this video introduces our CVPR 2025 work titled Robust Multimodal Survival Prediction with Conditional Latent Differentiation Variational AutoEncoder. Survival analysis plays a critical role in clinical decision-making. It aims to estimate the time until an event of interest, typically patient death or disease recurrence, for an individual or a group of patients. Traditionally, survival models have relied on single-modality data, such as whole slide images or genomic features. Recently, more and more works focus on a new frontier, multimodal survival prediction, which combines pathological whole slide images and genomic data. This integration offers more comprehensive perspective on patient stratification and prognosis. Although both pathological images and gene data have distinct features that are beneficial for survival prediction analysis, most existing multimodal models implicitly assume that both pathology and genomic data are available during inference. However, in real-world clinical settings, that's often not the case. Pathological images provide rich morphological features such as color, tissue structure, and cell texture. They are relatively easy to acquire. These tissue samples are already prepared during standard diagnostic procedures and can be digitized using scanning equipment. On the other hand, gene data reflects information such as gene expression patterns, genomic mutations, and overall gene activity. Compared with the image data, it requires complex procedures like genome sequencing or PCR-based tests. These are expensive, time-consuming, and not typically included in standard care, especially for broader cancer management in non-specialized settings. This discrepancy leads to a real-world dilemma. Even if we train a strong multimodal survival prediction model, we might not be able to use it in practice because many patients simply don't have complete genomic data. That's exactly the gap we aim to address in our work, designing a robust multimodal model that can still function effectively even when genomic data is missing. Traditional multimodal survival prediction methods are trained and tested only on patients with complete data of both pathological WSIs and genomic sequences. This restricts their usability to a small subset of patients. Once the model encounters a patient with missing genomic data, it essentially fails to make a prediction. This severely limits the potential benefit of multimodal learning. In contrast, our goal is to design a robust multimodal framework that can handle this issue directly. Our model is trained using complete multimodal data when available, but remains functional even if the genomic modality is missing during inference. A common way to address the issue of missing modality is to utilize one modality to reconstruct the features of another modality, and thus the reconstructed feature can fill in for the missing. However, such strategy still faces the following two challenges for the generation of the missing genomic features from the whole slide pathological images. The first challenge is that the representation of gigapixel whole slide images. The WSIs are usually with huge size, but only a small fraction of areas are closely associated with the genotype information. Hence it is challenged to learn effective representation from the WSIs for the reconstruction of the genomic feature. The second challenge is how can we generate the genomic embeddings with diverse function categories? Since different genes are usually with diverse biological functional impact, it is difficult to address such difference for the generation of genomic embeddings in a unified generative framework. To address the above challenges, we present a conditional latent differentiation variational autoencoder, LDCVAE, that can reconstruct the genomic embeddings with diverse biological functions from WSIs for robust multimodal survival prediction, even with the missing genomic data. The core idea is to leverage the pathological information to reconstruct and strengthen the genomic embeddings for better download multimodal fusion and prediction process. To address the difficulty in efficiently representing gigapixel WSIs, we propose a component called VIB-trans, which is based on the information bottleneck. Following the goal of information bottleneck, we aim to learn Z sub Y compressed from the pathological features Y while maximally conserving useful information for the survival prediction target T. Then, we use the variational information bottleneck to approximate the computation of IB by using variational inference with the objective function. Specifically, we use the transformer encoder architecture and take the instance-level features as input, and outputs the distribution parameters mu sub y and sigma sub y in VIB. In addition, we introduce two learnable tokens, mu token and sigma token, to capture global information from the pathological inputs and help construct the posterior distribution. In general, genomic features extracted from different functional groups usually have diverse statistical properties, making it challenging to generate all genomic features in a unified generative model. Therefore, we propose the Latent Differentiation Variational AutoEncoder, LDVAE, for the reconstruction of genomic features within functional categories. Specifically, we assume that each genomic feature is conditionally independent given a latent variable. Then, the objective of VAE can be optimized with the ELBO. We introduce the function-specific posteriors by applying a latent differentiation process that transforms the genomic posterior into function-specific posteriors. Therefore, we can establish a shared latent space on all genomic features as well as refining the function-specific posteriors for each genomic category. Finally, we can derive the loss function of ELBO in LDCVAE from the vanilla loss of conditional VAE. However, there is still an outstanding problem, that is the term Q of Z given X and Y, which represents the joint posterior of the pathological and genomic data. Here, we use the product of experts to approximate this joint posterior. Specifically, the joint posterior can be approximated by the form of product of the genomics and pathology posteriors. We can derive the closed form of the joint posterior as the product of Gaussian still follows the Gaussian distribution. To validate the effectiveness of our proposed method, we use 5 different cancer datasets from TCGA and compare with both the unimodal models and multimodal models. Compared to the best-performing model that relies solely on genomic data, our method improves the overall performance by 5.2%. On the other hand, when compared to the best existing models based on pathology images alone, our method shows a 5.9% improvement. Notably, when compared with all state-of-the-art multimodal approaches, our model achieves the highest performance in 4 out of 5 cancer datasets, with improvements ranging from 1.0 to 3.9%. We further compare our method with those models addressing missing modality to demonstrate the capability of our method in handling the missing modality of genomic data for survival prediction. We can observe that our method can achieve higher C-index values than the comparing studies. We also conduct the ablation study to verify the effects of each component of our method. The results show that each module in our framework can contribute to the final results. The Kaplan-Meier survival curves are always test the patient stratification performance among different methods. As shown in the figure, we derive similar stratification performance under these two settings across different cancer cohorts. These results further clearly demonstrate that the generated genomic feature by our method is also associated with the survival information, which in turn can help predict the clinical outcome of cancer patients. We present additional results for patient stratification using competing methods, including those designed for integrating multimodal data and handling missing genomic data. Compared to these methods, our approach achieves clearer separation between low-risk and high-risk patients across all datasets. In the log-rank test, our method can still consistently yield a lower p-value. These results highlight the robustness and effectiveness of our approach in accurately distinguishing patient risk groups. We further compare the co-attention weights that are calculated from the ground truth and generated genomic feature. Here we visualize the co-attention weights and show the patches with top 5 scores for the genomic features with the function of tumor suppression. We can derive similar visualization results of co-attention score among genuine and reconstructed genomic features. In addition, their corresponding top 5 highly correlated patches also share similar visual appearance. That's all of our video. Thanks for your listening.